of it. I'm quite proud to have you with us. First cohort of the joint medical master program here, a program that is a joint initiative of the University of Zurich and the University of St. Gallen. And we're super proud here at the School of Medicine to have probably one of the first joint medical master students that are brave enough to also start an entrepreneurial journey. And with you, it is intonate. And we are very, very interested in learning, of course, not only about intonate and what you are now offering in terms of improving also the healthcare system, but also about your lessons learned and entrepreneurial journey so far, so that the students also can use it for their group project here. And yeah, with this, I would like to hand over to you, Julian, and yeah, looking very much forward to your presentation.
Good. Thank you, Professor Kovac, for this kind introduction, and also thank you for this huge opportunity for our young startup to be able to present here. It's really cool. So maybe to dive right into it, we believe that, no, we don't dive into it yet. So this is the structure of our pitch today. We will pitch 15 minutes, and then I will talk about my founder's journey. And in the end, there is some time for questions and answers. All right. So maybe, yeah. At Intonate, we believe that we stand at a crossroads in healthcare, and to be able to sustain the accessibility of healthcare for everyone, we think we need to take a quantum leap in digitalization. But to begin with, let's start with you, the patients. I guess we all know how it feels to wait a week for an appointment with a doctor and spend an additional 30 minutes in the waiting room, only to meet the doctor who is busy keeping medical records straight and can't fully focus on you and your problems. The thing is, we doctors don't want to be distracted, but we face enormous challenges that prevent us from focusing on the patients fully. So a day in the doctor, we spend almost a third of our time documenting and creating reports and taking notes. How frustrating and also inefficient that is, I saw when I was working in hospitals. And the thing is, it doesn't stop in the evenings as well. So it's a major contributor to over hours. So it's not surprising that almost 20% consider changing career paths of the existing doctors. It's more even with the medical students, where it's more than a third. So all these problems translate into rising administrative costs in healthcare. This is no surprise when looking at the number, 34 million reports that are being generated every year in outpatient care. So the administrative costs are not only high, but they rise by roughly 18% a year. And this translates into rising healthcare costs for every citizen. If you think that these struggles or these problems are enough to think of innovative solutions, you're not alone, because we also think it's high time. And with the potential of, well, no, with the opportunity of generative AI, we think there is great potential to create some real impact. But for this opportunity to take hold, we need to think about how medical data is collected. Currently, this happens in a really chaotic manner. So some reports are stored as PDF files, some as text files, and some information is even contained in tables or lists. So besides providing structured data with our speech-to-text solution, we want to bring structure to existing healthcare data to be able to automatically create any reports that are requested by any of the stakeholders in healthcare. All of our data that we generate, and also some of the data we analyze, we want to put into an open source data set to advance digital biomarker discovery, which, to close the loop, will also improve our speech-to-text solution with new features concerning early diagnosis and also decision support. I'm sorry, this was quite a huge slide and probably difficult to understand. So let's take a step back and focus on our market entry again. This is how we want to go into the market. It's an ambient speech-to-text solution for general practitioners and specialists, where you can record your consultations and talk to your patients in your usual manner, also in Swiss German. And the most important information is the recordings are analyzed, and the most important information is curated in a text style of the doctor's choice. The software functions independently on mobile and on desktop, or in an interplay between both. And the reports that are generated, or the notes that are generated, can be sent via email or copied into your electronic health records. So we hope to be able to provide a substantial efficiency gain in general practitioner care, with up to 2 hours more time that doctors can spend with their patients. And if they decide to see more patients in that gained time, they will even have an additional revenue stream. These numbers are just estimates, and we hope to be able to confirm them or validate them in studies in the near future. So where are we in terms of market adoption right now? We deliberately kept the circle of early testers small so that we can iterate over the features and create new features with these early users, but also sadly fix some bugs that we encountered now. But we strategically chose those doctors because either they have a substantial network or have big offices where many doctors work. So with this internal growth in the practices, we hope to be able to expand to 60 users by the end of May. We also deliberately chose doctors from different cantons so that we have access to their respective associations of general practitioners, which also promises further growth. We developed a SaaS subscription service model with a price of around 150 Swiss francs, or a monthly fee of around 150 Swiss francs. With 19,000 doctors working in outpatient care, this leaves us with a market opportunity of around 30 million Swiss francs. But we should be able to significantly expand this market by also serving other providers, other healthcare providers like physiotherapists or psychotherapists, and venturing into different countries, and also serving larger institutions like hospitals or reha clinics. This will leave us with a total addressable market of around 15 billion Swiss francs. But of course, sadly, we are not the only ones that see the huge potential in ambient report generation, and the competition is fierce. You can see it on this slide. There are many players. We put special emphasis on Nabla and Nuance. Nabla is a French startup that raised significant amounts of money in a Series B funding to enter the US market. They also do a very similar product to ours. And then there is Nuance, which is an established player with established sales cycles also in Switzerland, and they are testing out a similar solution to ours in the US right now. But we really believe that we will be able to create a stronghold in Switzerland, in the Swiss market, with the iterative process we developed with the doctors, and create a workflow with them and for them that suits the Swiss market. And if it works here, it will also work in other countries. So we will still have the option of expanding further. So this is our team, our founding team. We try to cover all or different areas of expertise in our team, ranging from management over to computer science. Both Tim and Livio both studied at ETH, and I bring in the knowledge of medicine as a physician. And we try to mimic these areas of expertise in the advisory board. So we were able to onboard the former CEO of the University Hospital in Zurich, Gregor Zünd, for medical domain knowledge. And Anil Sethi and Stefano Brusoni advise us on entrepreneurship and management innovation. So let's get to the founder's journey. Yeah, let's dive right into it. So it's I mean, there is always a start, right? So for me, it was really the clinical experience when I started working in the hospitals and I saw the great dissatisfaction among the doctors. Also, it was kind of discouraging hearing some stuff that doctors said or discouraged us from becoming doctors because they said it's not worth it and we should really think about it. And I thought, I don't want to be like that and say stuff like that. So I thought maybe I could try changing something. And that's when I started to like the idea of bringing something new into the clinic. And with the rise of OpenAI and the boost in LLMs, I knew that something in the realms of automatic report generation would be possible. So that's when I contacted Livio. He's a good friend of mine. And together we developed a prototype, and this was also like a time where this was more like a hobby, and we did it very rarely, worked on it, but it was fun to validate some ideas and get in contact with some people. But I guess it's always like that. You have this idea and you think about it a lot, and suddenly it gets more important to you, and at some point you can't deny that you really want to try it, because you will never know the full potential of an idea if you haven't fully tried it. So when I realized that I was kind of like jeopardizing my other career options, I didn't like look for residency hospital jobs. And also like I didn't follow up on some opportunities in science. And at that moment, I knew that it's probably a sign to really try it. And that's when we contacted Tim, and another good friend of ours. And he really boosted our business development and customer acquisition, which was really important for us. But it was not, or it didn't take long until we ran into some challenges, actually. So the biggest or most prominent challenge we faced, and we didn't know about that before, because I think it's also somewhat specific to the founder's journey, is the chicken and the egg problem. So, for example, you would want to raise money to create a nice product that clients like. But for that, you need to talk to investors. But investors will only give you money if you already have clients. And to get clients, you need money to create the product. So it's really really difficult to break this cycle. And how we try to work around that, we don't have any funding yet, so we try to work around it by bootstrapping, just to come up with our own funds and really try to work our way around that like that. And also a really important thing is that we found great clients that are fine with an incomplete product and really want to support us and are early adopters, which is important because you can't really serve real clients at the very beginning. So that's how you can somewhat work around that. Then the second big challenge, and something we underestimated, is the roller coaster of emotions you go through. And especially in the beginning, your emotional reaction to certain stimuli is far greater than anything you've experienced before. And it's also, these cycles are pretty rapid. So one day you wake up and someone tells you they like your idea, and you are over the roof and think it's amazing what I'm doing. But like at the same night, you realize that you see competitors for the first time, and you think I should immediately quit. And this is like kind of a roller coaster. And these amplitudes somewhat get a little bit smaller. And what really helped us as a team is to set ourselves milestones, that we say we don't want to oscillate between quitting and thinking it's great what you do every day. So just create some milestones that are planned, and when we know when we achieve them, we know we're on a good track, and it is worth pursuing this thing. And if we don't achieve them, we need to be honest and quit as well. So this is, I think this is important to learn as well. And the third big challenge is the opportunity cost. I think this is also somewhat specific to the entrepreneurial journey of a physician, which is why I'm here to talk today, because I think there is rarely a person that studies medicine who doesn't dream of becoming a doctor one day. And like right now, I would be able to fulfill that dream, but I refuse to do it. And this is sometimes it's somewhat hard. And also, I see a lot of friends working as doctors, and even though they have to document very much, I still envy them sometimes because it's a nice line of work, and yeah, it's cool to do it. But also here, I think it's important to note that if you always think about opportunity costs and the salaries you miss out on, you will never do anything that is truly great and cool to do. So I'm grateful that I am able to pursue this way. Good. So I won't bore you any longer with my personal struggles. So let's move on to some challenges specific to digital health. The first big problem are the EHRs, or Praxisinformationssysteme, which are, as a digital health, or when you want to create something in digital health, you want to create the whole solution, which is really difficult because the information the doctor stores and processes is always stored in these Praxisinformationssysteme, which offer everything from document manager over to other clinical apps and patient registration apps, patient appointment apps. So they offer this whole solution, and it is really hard to get into these systems and also be integrated into them. And the problem as well is that you need to talk to them and get these interfaces so you can provide your information directly into these electronic health records, but you need to talk to them to every single one of them. And the market is really unconsolidated. So a big Praxisinformationssystem serves around 500 doctors. And we saw that the 19,000 doctors work in Switzerland. So there are many players. And I think this is a really important, or I think it's a really important thing that needs to happen, is that these Praxisinformationssysteme become more open and also allow other players to be integrated into their platforms, because only then the true efficiency gain can really happen. Also in terms of variables and stuff like that, these data need to be able to be integrated, and this happens to some degree as well, but not yet. So this is why we needed to get into contact with these systems. Good. Then the second big challenge is the regulation of medical devices, which is something you should start thinking about sooner than later, because as you can see, also software can be classified as a medical device, especially if it aids diagnosis and proposes any treatment and stuff like that. So the process is as follows. So if you are a medical device, you need to get certain certifications, which will take up to half a year and which costs around 50,000 Swiss francs. And you also need to be approved by a regulatory body. So this is really important to have in mind, and to start thinking about being a medical. If you do a digital health intervention, you should start thinking, am I a medical device or not? Because the design of the medical device will also, or the certifications will also impact your design, the desired design of your medical design. So this should go hand in hand. And yeah, I think it's just important to talk to an expert in this field early on.
Quick question to that one. Is the software that is used to document like a consultation hour, does it fall?
No, it doesn't. No, it doesn't.
Okay.
Yeah, we are really lucky that we have a good position, that we aren't a medical device yet. And we even asked Swissmedic about that. So we are sure that we are not a medical device, but still with large language models, which is a new technology, people or regulators are not sure if it is a medical device or not. So, and also we want to develop into a medical device, because there is where most or more fun is, like. Exactly. Yeah, Panita.
ask questions
we can start already, maybe with questions.
Yeah, sure.
Yeah,
Yeah,
okay,
But
cool.
in case if you would want to become a medical device, wouldn't that sort of like stretch out your like launch? Oh, yes. My question again for the online people, if you would go for the medical device route, wouldn't that sort of stretch out the launch of your software?
Yes, it would, but also you can as a company have multiple products, and you can have products that aren't medical devices and other products that are. So we could still continue with this product and launch a second product.
Also, you're planning on launching
Another product,
future
exactly.
products.
Yes, exactly.
Cool, cool. Okay, and for the product currently, would you also suggest that to not only for the doctors, but also like clinicians, like the nurses and clinicians working in the hospital using it to just like making the entire operational efficiency higher?
Yeah, that would definitely be the goal. I think at the stage we are now, it's really the easiest to get into contact with general practitioners, because the sales cycles in hospitals and also how they make decisions is really, really long and takes up to 2 years. And we don't want to get into these long sales cycles without having validated the product market fit in a real life scenario. So for us, it's really great to be able to serve general practitioners, which are their own bosses and can decide to use it or not. And yeah, but definitely this goal that also hospitals would need this kind of software.
Cool.
And also maybe here an interesting point is also we are not a medical device, but still some general practitioners demand some certificates, because it's just a mismatch. It isn't required, but they still want to have it as a kind of certainty sometimes. So this is also something we need to find out. Maybe also it doesn't bother them if we are a medical device or not. They still want to have the certification, which is also really understandable. So this could actually stretch out our launch.
Yeah, absolutely. There's like one point I have heard like last week talking to some like developers who are developing like medical devices, but also like softwares that don't qualify as medical devices. But if, let's say, your company would be able to acquire sort of a certificate that you are eligible to create any sort of softwares for medical use and might not be like falling under the medical device rubric, they actually might give you sort of like a label of this is approved for medical use, or like, let's say, in the clinical world.
Oh, okay.
Yeah.
Okay.
It's just something I've heard about, so you might want to like.
Yes, we need to check that out. That
Yeah,
is a great
so that would be
advice.
like another track without
Exactly.
going through this entire process, because it might take like months to years, right?
Yes, it does.
Yeah.
Exactly. Thank you. Yeah, Juliana.
I wait for the mic. Okay. I was just wondering a little bit how it works with the data privacy aspect, because you're not only recording the GP, right? You're also recording the whole talk that they're having with each other with the patient.
Exactly.
So how does it work, the process at the moment? Do they have to declare that it's okay for them to record it? Or is it different because it's not a medical product?
No, that is interesting, because that is also a question we had, because these are two separate things. So we at the data privacy issues, we for that we went to Valdervis.
My cousin works there.
Oh, really? Okay, nice. So we checked it out there, and really it's kind of complicated with all because we do the computing power is in the cloud computing services of Microsoft and AWS, Amazon.
Okay.
So but these are like certified servers and all that. So the thing is with respect to the formular, or the, what did you say? Einverständniserklärung.
Declaration.
Declaration, exactly. Patients don't, the most secure way to do it, or what we advise the GPs that use it now to do, is we give them an information sheet which just informs the patient what happens, and then they indirectly agree to this service, because the data privacy Erklärung of the general practice usually doesn't refer to data
From a third party.
From a third party, exactly. And
Okay.
they just say like data can be processed by third parties, but they don't say even they don't say it with a name. Like they don't say data can be processed by Microsoft, by Ametic, or whatever. So
Okay.
if it isn't mentioned, this is fine like that
So
with
you
this
don't
patient
need the
information.
okay from the patient
No.
officially. Ah, interesting.
Exactly. This would have also been like kind of a killer because
Yes.
no one no doctor
Use
would
it
use
then.
it with, because it's minutes we estimate to save them per patient, and they will lose this minute right away if they would need to
To
inform the
explain
patient.
it. Okay.
Exactly.
And I have another question,
Yeah,
but it's
sure.
not about the digital health issue. I saw that your team is actually, the skills of your team are pretty dominant when it comes to the background of the medical expertise, of course, and I would say computer science, right? Are you missing any skills at the moment? And how do you handle this if you see that, oh,
Yeah.
we really would need someone with this skill?
Yes. Well, it's not. I don't think that computer science is overrepresented, because Tim, he studied at ETH, but he studied
The
management.
MTech.
Exactly.
Okay, I see.
So he,
So best of both worlds, management and technology then. Yes,
exactly,
right.
exactly. So yeah, he doesn't know much about computer science.
Ah.
But exactly. So Livia does computer science, team management, and for me the domain knowledge. Maybe what would lack somewhere else is like the marketing aspect and stuff like that. But I think in medicine, which is a really like different kind of market where a lot of sales happen through referral, this is probably not as important. But I mean, if you look at our vision, probably something in the realms of data science would be a next hire.
Thank you.
Welcome. Okay, so I need to click through again. Okay, so these are some lessons we've learned. So when we talk to each other and discuss like how we want to advance and what strategies we want to develop, we always try to rely on the top thing. So these are our levels of evidence. The lowest level of evidence is a gut feeling, that you just feel like this is needed. And the second level of evidence is that you've read it somewhere or that you've heard it in a podcast, which is a reliable source, of course. And the best level of evidence for us is the direct feedback. If I may give you an example, when we started talking to investors, we had a lot of gut feelings of what they want to hear and when they will give us money. And it turned out that all of these were false. And when we talked to them, we directly heard that they want customers that pay for the solution, which is this is the goal we work for. And this saves you so much time in respect to everything. Also with clients, we were thinking about what do they want and how should we do and how should we try to achieve that. But as soon as you start talking to them, you realize it's not what you initially thought. Maybe it also is sometimes, but if you have the direct feedback, you make sure that you run in the right direction, because you have to run, you have to be quick. Competition is not sleeping. So be sure to run in the right direction. Exactly. And also here, it is important to note that already now that the team has proven to be a really important decision. And it's not only like the domain expertise that is important, but also generally how you think about stuff. So you should make sure that your team members think differently about a lot of stuff than you, because otherwise you don't have so many inputs. And for example, with me and Tim, it's always funny because he is an organizational talent and always knows what he needs to do today and in the next week. And I usually don't know that, but I like to think about how we want to develop in the next year or the next month. So I think this is really important, because if you don't have both, you will lack something. And you will get to know this as well. Good. So this is already my last slide. I was always against reading like business books, and I thought, yeah, but especially for me, it proved to be really helpful because I don't have an extensive business background, and you just sort of learn or how they talk, how the people who studied business talk a little bit. You start to understand a little bit of the things. These are really basic books. I think this is probably nothing new to most of you. But these are the books that helped me most up until now. So exactly. So I think this leaves me with one more thing to say before we head on to questions. I think it has been an amazing journey so far already, and I think you should, if you want to start something, you should be honest with yourself and also with all your family members as well, and also with your team members to really tell them that you want to embark on this journey and communicate often and honestly with each other, because you could run the risk of jeopardizing also your relationships and stuff like that. So be sure to be on the same page with everyone that surrounds you, and then I think it's a cool thing to try. Yeah, thank you so much for your attention, and I'm awaiting your questions as well.
Yeah, thank you so much. Fantastic. Yeah, I would like to start. I mean, you approached me, I think, also in October, November, and then we had a first exchange in January this year. And the first thing was like your first low emotion point with seeing what the others are doing. And in the US, for example, we know, of course, Epic, right? Epic is market leader. And if you can integrate with that, you have a huge advantage. So what is the, the direction you see you can excel and be maybe even better than Nuance by starting here in Switzerland? Because they will definitely explore something similar, right? Is it then the language? What do you think is the specific aspect?
Yeah, that's a really good question. We're also figuring that out right now. I think it's more something with usability, and because the technology is available for everyone, and everyone uses the same technology as well. But I think you can create some kind of impact with the usability, just how easy it is to use you, and also with that it's really important to be integrated into these EHR systems, because I mean, maybe it's also a tactic is that to be integrated into the most prominent Praxisinformationssystem in Switzerland, because then you have the integration there already, which Epic can take away from you. So this is definitely something, and we hope to just iterate over some features. And also, I mean, the goal is to directly create insurance reports, for example, and not just like notes as we do it now. And if we are able to do this, then this will definitely give us an edge, I think. And also going further in respect to like the whole vision, like with automatic report generation, if we have access to electronic health records, we can easily do that as well. So this would diversify our product as well.
And well, Swiss made, right? So it's this as well. A quick follow-up. One of the elements that we also looked into here in the lecture is, of course, the reimbursement model. And then you presented the 150 Swiss francs per month, etc. How did you define, or how do you define also in the future the pricing of that kind of service? Can you elaborate this a little bit?
Yes, sure. Yeah, I forgot it in the pitch. Actually, it derives from the value proposition we give, the competitive offering as well. Nabla, for example, offers their services for around 100, not Swiss francs, but dollars. And Nuance, for example, for $600 a month. So this is so it comes from that, and also our expected cost structure, because we need to pay the cloud computing services. That's a big part, and also our salaries and stuff like that. So this is how the price came to be exactly.
Okay, fantastic. Sorry, a last one, because I'm super curious. You know, we had for more than 10 years an open source software platform, Mobile Coach. And you mentioned on one of the first slides
Yes,
also
and
that
about-
the data might be made available open source. Maybe I didn't get this 100%, but this is, of course, I think coming back to your question, potentially highly sensitive data.
Exactly.
And if you anonymize it and make it open source, you probably lose a lot of value. So maybe some words about that part.
Exactly. Yes, I thought that this would be a part here because usually people don't get a lot of this stuff, you know. Like but you are right. It's probably really difficult, and we still need to figure out how we want to strategically move forward with this this data set. But like ultimately, I think it's just a question of effort you put in, and somehow it will probably work. That's our mindset now, and we are just really determined to make it happen because we think there is the great impact because of this project. And this will also, like, we also started this project to create impact, and we see our biggest impact with that data set. So but we are in talks with also some professors from ETH to talk about how we should proceed with like in regards to data strategy and stewardship as well. So but this is also yet to be defined.
Yeah. Okay. Yeah. A last comment, and then I hand over. I'm still very expressed. I mean, you did a live demo with me via Zoom.
Yes, exactly.
So that was so cool. So yeah,
Nice.
very,
Thank you
very
so much.
impressive. Yeah.
Thank you so much.
Okay.
Or maybe for the students. You do want to start? Okay. All right. Maybe I'm just not that well informed, or because I'm not really into the topic of generative AI. We're entering this area now. And maybe it's a stupid question that way, but how high is the burden with the Swiss dialects? Is it in Swiss German?
Yes, it works off the shelf.
Okay, really?
Yes,
Oh,
but
so
we
cool.
haven't done, we want to do an evaluation of how well it functions. We haven't done it. We just see that it works well enough to be able to serve some clients.
Okay.
But we want to do some analysis on how well it works. And if it doesn't work well, you can still tweak it. But right now it works off the shelf.
So cool, even with the Walliser Deutsch. Okay, crazy.
Yeah, not a huge sample size on Walliser. Yeah.
I would have a question concerning the acquisition of your kind of pilot customers, like the GPs that are using it nowadays. I think you said that there's some bugs still in the prototype. So how easy was it to convince them, or what did you pitch that they say, okay, we're trying it for now?
Yeah, well, I need to remember, try to remember what I said to them. I mean, these are just really cool doctors, and they are like early adopters, and they think everything that is new is really cool. And this is really, you wouldn't imagine how difficult that is to find such doctors, because like most of them, they are not as innovative as they are. So it really was just also much came also from their side, because of course there's also I mean, the most important thing is the clear communication. You just tell them we didn't know and we experienced a bug, and we are very sorry. You can use it, but you can also stop using it. It's okay, and we try everything to fix it as soon as possible. And like with this communication, it worked so far. We hope they will continue using it. But I think, or what I feel, that's the gut feeling thing. So it's not really evidence-based, but I feel like as long as we keep on doing incremental improvements and they see that something happens, they will use it. I think it's deadly to just wait a month and not being able to provide any new version. So this is why we want to be really fast with iterations over new features and stuff like that. And that is how we try to keep them.
Cool. Okay. So before Panita, maybe first here in the audience.
So I have actually two questions. So first of one would be the whole team aspect. So you said that it's all friends of yours.
Yeah,
I also know them personally, so cool for me. I would ask you now, would you consider doing it again with friends that you already know since your childhood, or would you consider doing it with complete strangers, or let's say study friends or something like this?
That's a good question, Philip. I think I personally still like the idea of doing it with friends, and I think also some like communication channels work well with friends, but also it's a good point, because you also run the risk of having some fights you otherwise wouldn't have. And also you run the risk of only that this is the only topic you talk about. So, but still, I think my relationship to Livio and Tim hasn't changed, or if it has changed, it has gotten better actually. As of now, I don't know how it will develop, but I mean, this is definitely something we need to keep in mind, and also cherish our relationship we have as friends again.
Okay, thank you. So second question is something completely different. It's about the future too, and not talking about the company's vision probably, but also your own thoughts about it. So we talked a lot about now this whole reports being generated automatically.
Mm-hmm.
So in my opinion, the big elephant in the room is actually diagnostics. So do you think, will there be an LLM or an AI model that will essentially then do the whole diagnostics and give me my my treatment basically that I need? So
yeah, that's a good question. Well, this is a great question, but it's also a difficult one, because I mean there are levels to this question as well. So I think in the short term, this it will definitely happen, I think, because it's so easy to do it as well. But the thing is, right now, I don't think that, like in healthcare, doctors are the gatekeepers of any innovation, and they will try to they won't use that in any time soon, or they will try to push it away, because it will ultimately replace them as well, in some degree maybe. So I think in the near future, this is something that won't come, and this is also the idea of why I got into this, because many innovations happen from outside medicine, and to create something from within, I think is also kind of cool. But also, I mean, yeah, it's a good question, because it will definitely happen, and I mean, we are so short of it that it is a reality. But I think it's important to see where it really helps, and where we can create impact there, and also maybe enhance care as a whole. I mean, it doesn't mean that doctors will be replaced by that, but it means maybe more accessibility for many more people for healthcare, and also maybe more stressless conversations with doctors, because they can really focus on other stuff than just diagnostics and like small stuff. But yeah, we will see that sooner than we think, probably.
it's also a bit of a philosophical question too.
Yeah, probably as well. Yeah.
Thank you.
Thank you, Philip.
Actually, I had a similar question as you, but on the other hand, like, because you wrote there early diagnosis and decision support, would you consider maybe implementing, like, let's say, recommendation that helps the doctor to decide the treatments and so on, like, let's say, more convenient, or is that something that you believe it's not right now the focus?
No, right now it's not the focus. I think well, like from personal, like what I like personally is the early diagnosis, and like when I did some science stuff, it always revolved around biomarkers and like prognostic biomarkers, also digital biomarkers, and I think this is really something that lacks right now in healthcare. I saw that also when I was working in hospitals, that many patients get a diagnosis but are completely unaware of whether they have the deadly type of disease, or they have an okay kind of disease. And I think this is something really important that needs to happen. And if we can leverage this data to give more like prognostic value to biomarkers that already exist, and also find new biomarkers that can have some prognostic value, I think this would create a really great impact for especially for patients. So
Cool.
this is the focus.
Yeah, cool. Cool. I also like one more thing what I mentioned before about this whole like certificate and so on. You actually had it on the slide. It's the
Oh.
ISO 13485.
Yes, quality management.
Yes, it's basically that one. And that would like
Amazing.
offer the market access to other countries much easier, as well as then the approval of hopefully the investors.
Yes, exactly.
Yeah.
So for context, these are the certifications. 13485 is quality management.
You have it already?
No.
Ah,
No,
okay.
that is just, but these are like the ones we would get. or
Okay, yeah.
27001 is
Yeah.
data privacy.
Yeah, because like what I mentioned, what I meant was like the ISO would be like for the company, whereas like for the medical device, it's not necessarily that you need to have that, right?
Exactly,
It's
you're
like a
right.
whole
Yeah, you're right.
differentiation. That's what I meant. Yeah.
But like as far as we understood it, these two certificates will make it easier for you to get the other ones
Yes.
that are that you will need for medical
Yes,
devices.
that's right. That's right.
You mentioned the meeting. I know them also to some degree. How easy is it to get an API to these systems? Do you have to pay for it? Like, is there a license fee, etc.? Do you have negotiations, like long-lasting negotiations? Like, how is that kind of process?
Yeah, I mean, I can tell you more about this in a few weeks because we are in talks with some providers, but so we still don't know. But what other people told us is that you would need to pay for an integration for a REST API. And I don't know if the numbers are reliable, but it's a significant amount of money. But we've also heard of a new company that offers their services on the platform and does some kind of partnership with them. And the negotiations didn't take as long, so it may be a few months. So we will see, but probably also it varies between the different players.
Yeah. And I mean, these kind of companies that are already in the market might maybe buy you, or right? I mean,
yes, exactly. Because actually you mentioned Epic, and I think this puts them under enormous pressure because there also are some voices saying, "Oh, everything should be in Epic in the whole of Switzerland." And I mean, so they are under enormous pressure. They need to innovate, but they are usually not very big companies, and it's hard for them to really ahead of the curve as well.
Cool. Any more final questions, maybe from the online audience? I didn't see anything. Now is the time. Maybe the last 3 seconds. If not, then one more time, thank you so much, Julian.
Thank you very much.
We wish you all the best of luck with the next steps, and you should update us in 1 year.
Yes, yes, I would love that.
In the same lecture, cool.
That would be great. Thank you so much for the opportunity. It was great to be here.
You're welcome. All right. Thank you.
Thank you.